Yes, very good evening, everyone, and welcome again from SNIC Rehab Foundation and Child Rehab Center, that is CRC, we are calling it. Good to see you all on this evening. So I will just brief you about SNIC and myself. I'm Harshali Kharche and I'm mother of two who are on spectrum, and I'm the director and the founder of the SNIC Rehab Foundation. What we do is we basically work in empowering parents and to sensitize them and to guide them into the right direction, towards the right professional, and to guide them, even to help them in many ways. Like we are running some awareness program, parent empowerment program, various activities program. Also, we are guiding them with the financial advocacy. We provide them the community support, and many more projects are going on. I will not take much of a time of yours, but I'll move faster because we want to hear Dr. Sumit Shinde first. So we are here today for our part 2 of autism treatment फ्रॉम डायग्नोसिस टू इंडिपेंडेंस. सो जिन लोगों ने देखा नहीं है, मैं अगेन रिपीट करती हूँ, वो हमारे यूट्यूब चैनल पे जाकर देख सकते हैं पार्ट 1, सो दैट यू कैन कनेक्ट विथ इट प्रॉपरली. So I would like to show you like where it is. Just 1 second. Actually, we have many other things to show you, like this is the channel of CRC, right? So here we have many webinars that will help you to understand various things about autism, hand flapping, and many more things like toe walking, difference between the autism and ADHD. Various videos are there who are very fruitful for all the parents. We have done a lot of things on that. So these are available on mainly on CRC. Also, we have done many series in lockdown with Sumit Shinde sir. These are the videos, you have it here. Many videos, many helpful sessions are there. You can go through SNIC channel also. Yeah. Okay. I will move it further. Okay. Now today we will start with today's topic, and I would like to invite Dr. Sumit Shinde. He's a pediatric occupational therapist and a rehabilitation consultant from Mumbai. So let's welcome Sumit sir. Over to you, sir. Thank you.
Thank you, Harshali. Um, yeah, so I just want to know who were there in the last session. Um, just say, raise your hand. Who were there in the last session, or all of you are new? It is great if you are all of you are new. It is good if you are there in the last session also. It will be a continuing things. Yes, right. So few flying balloons of hand flapping. Sorry, hand clapping. Um, it's Yes, yes. Okay, new. All right, all right. So I'll just take a recap of last time. Mm, Whenever we say autism, there is a lot, many things are there. It's a big balloon, and uh, it's like in birthday parties में हम जब ये balloon को फोड़ते हैं तो उसमें से बहुत सारी चीजें बाहर आती हैं, you know. वैसे when we come to know that uh, when a parent comes to know that his child is suffering from autism, then they try to search autism, and then this big balloon bursts, and lot many things, okay, comes out. Lot many therapies, lots of information, lot of philosophy comes out along with, you know, like you see, जब आप देखते हो, अगर आप गूगल पे कुछ सर्च करते हो तो गूगल उसका एक बहुत ही ज्यादा एक इन डेप्थ नहीं कहूंगा, लेकिन एक सीवियर रूप दिखाता है. अगर आप माउथ कैंसर देखोगे गूगल पर तो वो कंप्लीटली, यू नो, वेरी डिस्टर्बिंग इमेजेस आपको दिखाएगा. या माउथ अल्सर दिखाओगे तो माउथ अल्सर, एवरीबडी हैज माउथ अल्सर. यस, एवरीबडी हैज गॉन थ्रू माउथ अल्सर, बट गूगल विल शो माउथ अल्सर इन अ वेरी fearful manner. So it's kind of a it is a platform to create awareness by showing the extreme picture so that people will understand what is the extreme of that particular thing. तो वैसे ही पेरेंट्स जब गूगल पर जाते हैं तो एक बहुत बड़ा ये बलून बर्स्ट होता है एंड इट्स लाइक इट्स लाइक what to catch and what not to catch. You know, it's very difficult for them, for all of you. And then we get caught by some confident uh, so-called professionals, and then confident people around. They keep telling us कि ऐसा करो फिर वैसा करो फिर ये करो वे करो, and then here confidence wins because we are going through some kind of a stress. Okay, we parents going through some kind of a stress, so जो भी confidently कुछ बोलता है हम उसके पीछे भागते हैं. एंड इसमें सबसे इंपॉर्टेंट चीज है बहुत सारा टाइम चला जाता है. सो आई हैव टेकन अ लॉट मेनी लेक्चर्स ऑन दिस about me. Actually, as explained you, I've gathered around 18 years of experience in pediatric rehabilitation, where not from one clinic but multiple places, multiple special schools, uh, home visits, so many things. When I started, when I wanted to stay back in India, I just wanted to gather a lot of experience, call myself as a professional, you know, and saw a very low socioeconomic child with a suffering from autism, saw a big businessman's child, saw middle class families, saw a number of families. Like in India, you autism किसी का घर देख के नहीं आता है. तो I saw the culture. I went through the culture. I went through the n number of things, surroundings, very different genres of families, types, and where kid was suffering from autism. So it is a lot of experience. And when Harshali like people comes to me and tells me ki, please share some knowledge. So today we have started with this series of autism treatment, because nowadays everybody's treating autism. Everybody's treating autism. Okay, and claimed self after 6 months, 10 days, of course, people so claimed autism professionals, autism experts. This particular series is all about I'm sharing my experiences. Okay, you will not find this on Google or anywhere because it's something, this terminology you will get it from me only. So last time what we discussed is all about autism treatment models. What are the different, if anybody is helping or if any parent is going through some kind of a treatment, what are the different classifications they are going through, which we classified, me and my professionals at CRC. We classified these models and we are working on this since last almost 2 years. I'm working, and especially post COVID, things have changed. एंड उसमें से हमें 3 मेजर क्लासिफिकेशंस हमें दिखे, जिसमें से मैंने उसको नाम दिया है वन इज ऑटिज्म मेंटेनेंस ट्रीटमेंट मॉडल, सेकेंड इज ऑटिज्म ट्रेनिंग मॉडल, एंड थर्ड थिंग इज ऑटिज्म डेवलपमेंटल अप्रोच मॉडल. ओके, तीनों भी मॉडल अपनी अपनी जगह पर सही है, अपनी अपनी जगह पर सही है तीनों भी मॉडल, लेकिन कौन सा मॉडल कहाँ पर यूज करें, और ये मॉडल्स एक्चुअली बुक्स में नहीं है बट आई हैव सीन. तो लास्ट टाइम ने हमने इन मॉडल्स को डिस्कस किया था कि व्हाट इज मेंटेनेंस मॉडल. मेंटेनेंस मॉडल इज ऑल अबाउट आई कम टू नो माय चाइल्ड इज हैविंग बिहेवियर्स, सो आई विल कीप वर्किंग, आई विल कीप करेक्टिंग दोस बिहेवियर्स. सो हैंड फ्लैपिंग है तो हैंड फ्लैपिंग कम करने के लिए मैं उसकी ट्रीटमेंट करता रहूंगा. एंड हैंड फ्लैपिंग है, टो वॉकिंग है, I will see a behavior and I will keep working on it. I will put my expectations behind this thing. So maintenance model is all about trying to work on cosmetics, you know, cosmetics. कि वो छुपाने के लिए, वो सही वर्ड नहीं है छुपाने के लिए, लेकिन दूसरे बच्चों के जैसे बिहेव करवाने के लिए, या दूसरे बच्चे जैसे नॉर्मली बिहेव करते तो वो बिहेव नहीं करता है, तो वो बिहेव नहीं करता है जिस बिहेवियर्स की वजह से, वो बिहेवियर दबाने के लिए या बिहेवियर को ट्रीट करने के लिए ये मॉडल यूज किया जाता है. दैट इज ऑटिज्म मेंटेनेंस, treatment model. So lot of behaviors are focused and और वो बिहेवियर्स पर काम करते करते कभी हमारे 2 4 5 साल चले जाते हैं एंड चाइल्ड का ऑटिज्म को ज्यादा ध्यान नहीं दिया जाता है, उसके सिर्फ बिहेवियर को इम्प्रूव करने का ध्यान दिया जाता है. दैट इज मोर ऑफ अ ऑटिज्म मेंटेनेंस मॉडल. आई विल कॉल इट एज अ मेंटेनेंस मॉडल. सेकेंड मॉडल व्हाट वी डिस्कस्ड अबाउट ऑटिज्म ट्रेनिंग मॉडल. इसमें बहुत ज्यादा बहुत ज्यादा कॉग्निटिव एबिलिटीज के ऊपर ध्यान दिया जाता है कि कॉग्निशन यानी कि बच्चे को पजल देकर उसको एसोसिएशन डेवलप करना, उसका स्कैनिंग क्रिएट करना, मैचिंग करना, बहुत सारी एक्टिविटीज दी जाती है जिसमें विद एक्टिविटीज में बच्चा माहिर होता है या शायद वो एक्टिविटीज में से कुछ स्किल सीखता है. तो बच्चे का अटेंशन बढ़ाना है तो बच्चे का सिटिंग टॉलरेंस बढ़ाना है, बच्चों का स्कूल में बैठना चाहिए, दैट इज. एंड वो बैठने के लिए we have to we have to treat him so that he will sit for 1 hours or 2 hours or 3 hours or 6 hours. तो वो हमारा जो एक्सपेक्टेशंस है कि ट्रेनिंग मॉडल बच्चे को ट्रेन करना है, चलते कैसे हैं, बैठते कैसे, वो ट्रेनिंग मॉडल. ट्रेनिंग मॉडल में सबसे बड़ा अप्रोच यूज किया जाता है एबीए, जिसमें रीइंफोर्समेंट बेस्ड चाइल्ड को रिवॉर्ड देकर उस चीज को किया जाता है. फॉर एग्जाम्पल जिसमें सपोज द चाइल्ड इज नॉट सिटिंग, तो चाइल्ड इज गिवन सम एक्टिविटी एंड देन and if he's sitting properly then he's given a reward, something like that. It's classical conditioning and there are few things are also used. ये मॉडल बहुत ज्यादा यूज किया जाता है where child going to school और स्कूल में कुछ पढ़ाने के लिए या स्पीच थेरेपी या कम्युनिकेशन को पढ़ाने के लिए, सिखाने के लिए बहुत ज्यादा ट्रेनिंग होती है, बहुत ज्यादा क्वेश्चन आंसर बेस्ड इसमें ट्रांजैक्शन होता है बच्चे के साथ, जिसमें ट्रेनिंग मॉडल. तो मेरे माइंड में एक परफॉर्मेंस है और वो परफॉर्मेंस बच्चे ने भी करना चाहिए. दिस इज द मेजर दिस इज द मेजर थिंग जिसमें मेरे माइंड में एक परफॉर्मेंस मॉडल है कि ऐसा यही अच्छा है, यही सही है, पजल ऐसे ही बनाना है या ऐसे ही जंप करना है. तो बहुत ज्यादा एक्टिविटीज को ट्रेन किया जाता है. मैनी ऑफ द एक्टिविटीज आर ट्रेन्ड एंड देन द चाइल्ड बिकम्स ट्रेन्ड इन एक्टिविटीज. दैट्स मोर ऑफ ट्रेनिंग मॉडल. And third type of a model which we discussed is a developmental approach model. And this developmental approach model is all about understanding, evaluating the child's developmental stage, evaluating child's developmental concerns, understanding the dysfunctions behind the concerns, understanding the development behind dysfunction. Even the child is clapping hand or child is not giving eye contact, not giving name response, but still what is there in the child who's doing appropriately, वो बच्चा क्या सही कर रहा है, ताकि उसके ऊपर ध्यान दिया जाता है. इट्स मोर ऑफ अ स्ट्रेंथ्स आर गिवन, आर एनहांस्ड, जिसमें सबसे इंपॉर्टेंट पहलू होता है बच्चे का बिहेवियर नहीं. इसमें इंपॉर्टेंट पहलू ये नहीं होता है कि बच्चे का एजुकेशन, एकेडमिक्स एंड ऑल. इसमें सबसे इंपॉर्टेंट चीज होती है कि बच्चे का डेवलपमेंट का स्टेज क्या है. जैसे नॉर्मल डार्विन ने जैसे थियोरी बताई थी ह्यूमन इवोल्यूशन की, तो बच्चा 1 साल में, या बहुत सारे डेवलपमेंटल साइंटिस्ट्स ने जो थियोरीज बताई है, जिसको शायद पढ़ने के लिए यू मे रिक्वायर अ लॉट मेनी इयर्स. ओके, Piaget's theory is there, Erik Erikson's theory is there, Bandura's theory is there, Darwin's theory is there. Freud also gave some kind of theories. So जिसमें आपको अंडरस्टैंड करना होता है कि कौन सी थियोरी में वो बच्चा ऑपरेट कर रहा है या कौन से स्टेज में वो बच्चा ऑपरेट कर रहा है, एंड देन गोइंग टू दैट लेवल, कनेक्टिंग टू द चाइल्ड and working on the dysfunctions where the brain is not able to learn. Then once you start working on a child, जब हम बच्चे के ऊपर काम करते हैं, then the first thing we get outcome is connection with the child. Child starts getting connected with self, then connected with the parent, and then connected with the environment. Okay, and that creates a molecule of social communication and social interaction. And that molecule, when you keep working on it, child starts developing interaction and communication. So last time I started with the definition. Autism is all about, it is not a behavioral disorder, it is not a learning disorder, it is not ADHD, it is developmental disorder, neurological developmental disorder, in which three things are affected. सबने पिट पैट किया होगा. Communication dysfunction, social interaction dysfunction, and third is a presence of repetitive behavior, but they are not abnormal. We call them, everybody calls them abnormal, but they are not abnormal. They are some kind of a needs of the brain to regulate self, to calm down self, or to activate self. They are not stereotypical behaviors. It is written as observations, and these observations, when they are written on the, when they are written in the books, if you read, they are observations, they are, or they are symptoms, they are not negative things. वो निगेटिव चीजें नहीं है बच्चे की, कि वो बच्चा फ्लैपिंग कर रहा है तो निगेटिव बिहेवियर है जिसको आप रोकने की कोशिश करते हैं, है ना? और जब ये डायग्नोसिस को आप ठीक से समझेंगे तो सिर्फ दो तीन चीजें ही सामने आती है. वो है, सबसे पहला है डेवलपमेंटल डिले. Okay. Second thing is stuck in a particular developmental stage. For example, जैसे मुंबई में हम लोग रहते हैं तो मुंबई से लोकल निकलती है तो कोई एक लोकल फास्ट निकलती है, दूसरी लोकल स्लो, हर एक स्टेशन पर रुकते जाती है. और कभी कभी वो लोकल को जब ज्यादा सिग्नल्स मिलते हैं या तो शायद कुछ आंदोलन होता है और वहां पर वो वो लोकल रुक जाती है, दैट लोकल स्टॉप्स. Local is still on the track. It is not gone out of the track. It is still on the track. Once that clock gets over, once it gets a green signal, it will move ahead on the track. If and or we follow, अगर हम वो developmental approach को follow करेंगे, then development will grow. Autism का, शायद बच्चे का ऑटिज्म चाइल्ड है जिसका एज है 8 साल, उसका सोशल स्टेज है, हम लोग कहेंगे सेंसरी मोटर स्टेज, जो शायद 1.5 साल में या 10 महीने का है, 12 महीने का है, शायद वो 10 महीने या 12 महीने या 14 महीने का स्टेज दिखा रहा है, या शायद कोई बच्चा है 6 साल का लेकिन वो डेवलपमेंटल स्टेज दिखा रहा है शायद 1.25 साल का. ओके, इसके फंक्शनैलिटी, उसका उसका सोशल अवेयरनेस, जो अपना अवेयरनेस जो उसने डेवलप किया है लिमिटेड है, लेकिन जो है तो उसको हम लोग उस ट्रेन का ट्रैक कहेंगे. वहां पर जब जाके हम लोग उसको टच करते हैं, उसको कनेक्ट करते हैं, एंड देन व्हेन वी वर्क ऑन डिस्फंक्शंस, जो अवेलेबल डिस्फंक्शंस है, मे बी सेंसरी डिस्फंक्शंस हो सकते हैं, कुछ न्यूरोलॉजिकल डिस्फंक्शंस हो सकते हैं, व्हेन वी वर्क ऑन इट, वी व्हाइल वर्किंग, हम सबसे इंपॉर्टेंट चीज होता है वी कनेक्ट विद द चाइल्ड. एंड वंस वी स्टार्ट कनेक्टिंग विद द चाइल्ड, लेट मी टेल यू वन थिंग, ह्यूमन एंड एनिमल्स, इसमें फर्क ये है कि ये फर्क नहीं है कि वो 4 पैर पर चलते हैं, हम लोग 2 पैर पर चलते हैं. फर्क ये है हमारे इवोल्यूशन का, वी हैव अ सेरिब्रल कॉर्टेक्स एंड दे डोंट हैव अ सेरिब्रल कॉर्टेक्स. सेरिब्रल कॉर्टेक्स यानी कि जो हमारा दिमाग जो सोचता है, जो इमोशंस होते हैं, जो आइडिएशन करता है, अलग अलग तरीके से लर्न करता है. ओके, मैंने कहा लर्न करता है, ऐसे ब्रेन लर्न्स. Cerebral cortex has ability to learn new things, but animals में ये cerebral cortex नहीं होता है, जो जिसके वजह से they can be trained. Okay, so cerebral cortex has ability of learning. Learning means I will get inspired from somebody who's dancing. I feel like dancing and I want to dance, and I became a dancer. Okay, I saw my papa is sitting on a computer and these things. I get inspired from it and I start typing. Feel like I want to type it. Okay, right? When it will happen, when I'm feel joyful and I'm feeling explorer. Okay, so I'm developing a little exploration ability and I'm feeling joyful, then automatically my cerebral cortex will start getting activated and I will start learning. What is a parent's and therapist's job? Creating the opportunities, creating challenges where my learning will be challenged. Okay, so that learning different ways, different ideations will develop. Okay, everybody is getting me? Please put in the chat box if you are this thing. Apart from language, I mean, I will be into a different languages. मैं English हिंदी में बात करूँगा. But it's to understand. I don't think to understand you need language to understand. You just need to be there. Even if you understand my expressions, you will learn. So coming to the point over here, autism is all about, okay, connecting the body to the cerebral cortex, and cerebral cortex need not be trained. उसको ट्रेनिंग करने की जरूरत नहीं होती है क्योंकि उसकी एबिलिटी है लर्न करने की. दैट इज व्हाट द डिफरेंस बिटवीन एनिमल एंड ह्यूमन बीइंग. एंड ऐसा कोई भी ऑटिज्म का बच्चा दिखाइए जिसके एमआरआई में सेरेब्रल कॉर्टेक्स नहीं है या जिसके सल्का एंड गायराए उसमें कम है, ऐसा कोई भी ऑटिज्म बच्चा नहीं है इस दुनिया में. एवरी चाइल्ड हैज अ सेरेब्रल कॉर्टेक्स, बट okay, if we try to connect with a mid-brain level and a lower brain functioning like training with a classical conditioning, then the child will never go to the cerebral cortex and it will become a robot. And that has happened in last many years, where so many so-called helping people, you know, without having adequate anatomy, physiology, adequate developmental psychology, developmental stages knowledge, they just created a training model for autism children, and that is become so much famous that nowadays people come to me and say, "Oh, chhod dijiye aap." I mean, that's okay. You tell me how to improve the attention. No. So every child has attention, every child has all those cognitive abilities, but they are masked because their learning ability is reduced because of certain problems, certain issues that I will discuss in the coming lectures. Okay. So I discussed about three models. One is a maintenance model, second is a training model, and third is a developmental approach model. Okay. Maintenance model, just cosmetically seen and cosmetically in comparison with other child is doing football, so I will also send my child football. Other child is doing cycling, I will also send my child doing cycling. There is development is not there. I don't know whether those skills are going to help me in my adulthood or no. Since everybody is doing, I am also doing. You know, in maintenance model, lots of trial and errors are done. Whereas training model, what dysfunction is, I don't want to look at the dysfunction. Okay. I have less time, so I want to work on his training. Just want to give him a lot of training. That is training model. Okay. And third thing is developmental model, which I explained you. Anybody have any queries about? You can. I take two questions over about this. Don't ask me about your child. About this, let's look at the autism and how we are getting treated and how the treatments are happening. You know, from the helicopter view. Then only we will get the actual understanding of how we can help our child. I'll just go to the chat box. Any relevant question? Arshal?
Not yet.
Okay. Okay.
If you have any questions, Disha, you can put it
So
in chat box.
yeah. So somebody asked, please explain more on these models. Okay.
Yes.
Maintenance model is all about trial and error. You know, I'm just since last 1 year, I'm concerned about my child's hand habit. I'm not concerned about anything. I'm 90%. I just want to see that he's not hand clapping. I want to stop his hand clapping. I want to stop his walking. I want to stop his, his negative behaviors or job behaviors. Not even negative behaviors. Behaviors. I want to stop. Okay. Second thing is training model is all about I want to train my child. I want to see my child like other children are doing. So I will train him. Even though he's not developed that learning ability, I will train him. Okay. Developmental approach model is all about no training, nothing. No treatment also. Let me understand the child's development. Where is he standing? Where is he getting joy from? Where is he more curious about? And that curiosity, that joy, which stage of a development the child is seeing? As per that developmental stage, okay, what are the dysfunctions he's showing because of which his brain is not moving ahead? What are the dysfunctions? The dysfunction can be sensory, modulation dysfunction, it can be a registration dysfunction, it can be a many neurological dysfunction. Okay, what are them? And then accordingly create a protocol of a developmental goals so that we can move ahead, on that track only. Most of the time, what happens? People lose that track, take that plane out, और वो खेतों में खलियानों में करके hills पे लेके चले जाते हैं. So that should not happen because every autism child has all types of brains and all the brains are intact. They are not affected. Okay, so it's a very important thing. But most of the time, what happens? We parents, we therapists, we outside people become more, I will not say impulsive, but become more stressed, become more urgent. It becomes an urgency that child should behave normally, you know. And in that things, we get caught with many other people, and then everything becomes everything all the ladders. We try to use and don't know which ladder to use, uh, and then falls into that maintenance and training model. 90% of the people outside who claim themselves that they are actually working on autism, they're training autism, they are operating from the maintenance model and training model. Okay, I would like to give an example over here.
Sorry to interrupt you,
Yeah.
sir. That is
Yes.
a question that I was coming to for example only because someone asked that how to develop a connection with child naturally. But second question is most important: in how to analyze developmental stage of my child. So if you can share some example for this, though, that would be very helpful for us. Yes, sir.
So we need to over here understand the point, or I may share a few things, or if you want me to share, I will explain you how as a professional we look at autism. Chalo, I will share it since it is an open thing.
See,
Um,
because of that only, I could understand that how my child's development is happening.
yeah.
So, please, sir. Yeah, thank you.
So let me see. Okay. So, can you see the background? Sorry.
Yes, yes, you can
Yeah.
see, sir.
So I go to my. This one. Is it visible?
Yes,
Yeah.
sir, it's visible.
Now, so this is let me show what exactly happens in a developmental model where I just take any child. Okay, I just a few days back. Oh, yeah. Okay, so child's name is Avyut. He was having some uh, regression issues. Till 23 he was doing good. December, and then later on he shown some these things. Eye contact, little bit was there. He's a 2.5-year-old child. When came to us for a consultation, then Um, let us see. He shows echolalia, initiated one or two word sentences, or behaviors point of view. We can say not sitting at one place, jumping and shouting, running when excited, lying down and crying while demands are not fulfilled, throwing objects when angry. So here we are seeing a child who's a bit aggressive and self-directed, uh, fearful of swing, going on height. So this is a typical child who's stuck in a particular developmental stage. If I go to his, sorry, I just sorry, just a moment. Is my screen visible?
No, no, not now.
Okay. Okay. Is it visible?
Yes.
I was in this child. So in consultation, we saw that the child is having some behaviors about his behaviors, that he was not sitting at one place, a bit hyperactive. Many behaviors where the parents were showing concerns with respect to socialization, communication. So somebody asked me about what we can do, what we did, how developmental approach goes ahead. So I just go to his psychological testing. With his 3 years, and with respect to what VSMS, we saw that his chronological age is 3 years and his social age is 2 years 7 months. Okay, so, this is retesting. Not getting just a moment. I'm getting a little glitch over here. I'll just so is it visible?
Yes, yes, it's visible, sir.
Screen is getting stuck. Mm, dysfunction.
Parents have some patience, we have some technical issues. So I know these days patience is really less. Yes, it's visible, sir, now.
Okay, so I'll take another child that thing was getting crashed again. So mm, the child is 2 year 9 months, showing red flags of ASD and ADHD. Let us say showing chief complaints of speech delay, less social, closes eyes, shy, less reactive, cranky for needs. Then avoids eye contact with strangers, gives eye contact with two familiar people, but don't sustain response to name. Around 6 out of 10 times he was on a regression side. Basic command following there, but only to parents. Then behaviors point of view, lot of self-directed behaviors, irritable, cranky, less responsive to parents' communication. Frequent arousal fluctuations, sudden abrupt of crying, irrelevant laughing, condition-based, routine-based performance. So all those things what we see in autism, the child was showing. Avoids messy play and wet clothes. So when we saw a basic SI, so we saw in that sensory integration frame of reference, we saw that arousal fluctuations are there. Generalized hypotonia child is showing weak core, affected adaptability, extension synergy. So multiple things we saw in that. Now, this child, when we did his psychological assessment, somebody asked me how to understand the development. Based on that, only I came here. But we did few testings over here. First test is Wineland Social Maturity Scale. Now, let me explain you Winelands. There are different types of quotients of development. One is a first is a intellectual quotient. Okay, जिसको हम लोग IQ कहते हैं. We call it as IQ. Second quotient is an emotional quotient where how that understands emotional abilities or coping mechanisms. And third quotient is a social quotient. Social quotient is all about the sociability it understands. Okay, how the person is social, how the child is social. And in that scale, when we say autism, autism is not a cognitive disorder. Yeah, cognitive dysfunctions will be there, but it is not a cognitive disorder. It is not an emotional disorder. Okay. It is more of a social communication development disorder. Okay. So when we see this child, जब हम इस बच्चे को देखते हैं कि now child's chronological age is 2 years 10 months. I'll just put it over here. Okay. Social quotient is 58. ये बच्चे का शायद social, I mean, typically, normally, ये social quotient होना चाहिए. Anything beyond 90, we call test says 95 and above. Where the child is 2 year 10 months and child is behaving like a 2 year 10 months, but here social age is coming 1 year 8 months. Now, in 1 year 8 months, the areas of concerns are he's not developing communication, occupation. Occupation is all about how the child engages self in a particular day-to-day activities, play, imitation, and all those things. Self-help eating, dressing in self-help general, like how the child takes his own care in any given challenge, as per the age. So ये जब हमने देखा So the child's social age has come to 1 year 8 months. Now this 1 year 8 months is important in one aspect, but that is not a diagnosis. Diagnosis is when we do this child's psychological testing with respect to ये बच्चे का social age 3 साल से सॉरी एज 3 साल से कम है, इसलिए हम लोगों ने उसका अनऑफिशियल गार्स किया यहाँ. Okay, see, we cannot do the test. We cannot say the test child is having autism, so we have to do unofficially over here. Okay, so here the child's social age is come to 1 year 8 months. Now coming to the Gilliam Autism Rating Scale. Gilliam Autism Rating Scale is a worldwide used scale, very well known. GARS 2, it is now the GARS 4 has come, but it is a wonderful scale for a professional to understand in a very less time which are the difficult areas of development, and on the scale of autism, which are the difficult areas which are more popping up, which are affecting development. So social age is 1 year 8 months. Okay, in that he's showing these behaviors, like stereotypical behaviors are showing very likely, communication is showing possibly range, and social interaction is very likely range. Autism index comes to possible range, जहां पर anything is more than 85 and higher is very likely. This says severity, and 69 and less is unlikely. Okay. Now that was a parent's thing. It's not about what therapist feels कि मुझे लगा वो बच्चा रो रहा है, बच्चा आई कांटेक्ट नहीं दे रहा है, child is not behaving as per my perception, I will call him as autism. No, it's not like that. This test is done on parents, and second, after few sessions, after 4 or 5 sessions, or let us say 10 or 12 sessions, the same test is done with therapist, and therapist says, okay, stereotypical behavior we are not this thing, parents are a bit exaggerating, parents ने यहाँ पर exaggerate किया था, but child's communication with outside people is very likely. Okay, and social interaction is very likely. Okay, so same child at home, his stereotypical behaviors are very likely. That means हमें ये समझ में आता है कि how much child is engaged and not engaged at home. Okay, maybe parents के साथ वो बच्चे का communication अच्छा है. Okay, but social interaction is affected in both the areas. Everybody is understanding? Okay, so how the child is behaving as per the society, and how the child is behaving or how the child is developing as per the parent, there are two different perceptions. In that we understand, okay, the communication in a social area, जहाँ पर वो जब therapy center में आता है, तो how the therapist के साथ वो after 10 or 12 sessions how is gelling, based on that therapist gives his their remark. So there they say the stereotypical behavior is not a problem for us. Child is flapping, that's okay. That's not a concern. But concern is communication and social interaction. And autism index comes to 98. That comes to very likely. Okay. We did is other test also, that is ADHD, because the child is showing some kind of a hyperactivity, not sitting at one place. But astonishingly, यहाँ पर parents का score आता है बहुत कम, which is below average. So यहाँ पर even though child is a bit restless, the child is not sitting at one place, ADHD quotient is not seen. This is a differential diagnosis. तो बहुत बार पेरेंट्स को मैं ये बताना चाहूंगा, आई वुड लाइक टू टेल पेरेंट्स, जो दिखता है वो जरूरी नहीं है कि वो है. Maybe the child's needs are different in that particular developmental stage, which we need to understand with multiple things. Diagnosis cannot happen in 5 minutes. Diagnosis cannot happen in one sitting. Diagnosis cannot happen in 2 to 3 sittings also. Diagnosis happens after multiple observations where the child appears when he's comfortable in the environment, in the therapy environment. Then the diagnosis should be confirmed. Always, this is a very important thing. There are many impulsive people कि हाँ eye contact नहीं दे रहा है, नाम response नहीं कर रहा है. Is this things? Many children, if you have seen, even the typical children, when they come out of some kind of a disorder, some kind of a sickness, their abilities also goes down. Okay, so we should not be impulsive in diagnosing the child. So यहाँ पर childs का very likely stage में आ रहा है. Am I audible? Yes.
Yes, yes.
Yeah. So even the therapist score, even the child on the consultation, parents say that he's not sitting at one place, is everywhere. Therapist score also comes low. Now the professional should sit, the therapist should sit with the parent, explaining that we are getting these challenges. The child is not socializing and interacting in the society. And at home, you are giving more focus on his behavior. These are stereotypical behaviors. Okay. But maybe communication point of view, you have got to his level. That's a wonderful thing. That's why he's maybe interacting for mostly it is a need base and social interaction is still not there from their perception also. Coming to the first review now, when we say developmental approach, how it happens. Is the screen visible? So now Advait is 2 years 11 months. एक महीने के बाद हम लोग इसका review करते हैं after few sessions. We see few improvements. I'm not saying development. We see few improvements. Parent says after 20-25 sessions, child shows improving arousal. He's more well-being. Okay, he's more alert. He's more aware. Okay, adaptability. Like he started accepting little bit challenges. Okay, in environment and at home. Blah 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 blah. So many things are there. You can go through it. Okay. Uh, please don't write on a screen. It's not a whiteboard. When developing emotional reciprocity, it's not developing. It's not developed. It's little bit. Little bit means what? Molecule level. अगर क्वेश्चन साइंस पढ़े तो molecule, it's small level. Parent says 2 to 3 minutes. Okay, in a day, I saw the child is interacting with me with a joyful and with a very explorative way. He's trying to be with me when we start with the protocol. Okay, so developing orientation, interaction, emotional. This is not a complete development. This is not development. This is little bit small glimpse of observations that parent says, and then we, based on these developments, we have impairments, we have strengths and weaknesses. Based on that, we keep certain goals for the child for the next months. Okay, now what we have, can anybody write in the what raw material we have? We have 1 year 8 months, social age with very likely communication dysfunction, very likely social interaction dysfunction. Okay, stereotypical behavior as per the parents very likely, but for us, we want to we saw the stereotypical behaviors are not concerns. They are just needs of the neurology. They are the needs of brain to where so called on Google it's affected wiring. Okay, because of that, child's brain is trying to get more and more body awareness, and that's why few stereotypical behaviors were coming. We wanted to be more focused on communication and social interaction. So here certain goals we keep that after 2 months, Advait will respond to his name 8 out of 10 times in one go. He will come from another room and look at the person. So he will call his Advait. So parent, the child will come from another room, okay, and he will look at the parents. Whoever called him, maybe there are 2 to 3 people are there. When mother calls, he will look at mother. He will give eye contact to mother. Okay. He will respond from 100 feet distance when you take him out in a garden area. So garden से अगर आप जोर से बुलाएंगे, something like Papa is come from the office and mommy is with Harvard in the garden. Papa calls him from far. Harvard will try to locate the lone person. Okay. It's a very specific goal we made for Advait, not for every child. Don't copy these goals. Again, you will go into the maintenance model. It is only for Advait because based on his observations, his evaluation, day-to-day interaction, various approaches we used, and glimpse of improvements is shown, we kept these goals. The goal can be will sustain eye contact for 3 to 5 seconds. Child cannot, nobody sustains eye contact more than 5 seconds. Okay, so please stop torturing. He look at me, continuously look at me. It's not eye contact, it is visual fixation, visual localization. Yes. मैं बहुत impulsive हो जाता हूँ इस चीज़ में. I'm sorry, we are losing our time. Advait will express sensory-based experiences to various these things. He will express. I did not write. He will say, but when थोड़ा सा गर्म है, he will show something like that. Why the child will show? Because parent is well connected, child is well connected by the end of 2 months, and child will start expressing what parent expresses. Child will start imitating their expressions. It's not like parents has to train the child. Parents should not be training the child. Okay, parents should be behaving like a normal biological parents. यहाँ पर parents को properly guide किया गया है. Be like a normal biological parent, just like a 1.5 year old child of any parent of a 1.5 year old child. There's one more goal we can say. Um, like he will look at object when we take its name. That name or its object is not flashcard. The object is fan. And fan हो गया. Maybe AC, maybe fan, maybe TV on, maybe mobile. Anything which is day to day used. Okay. Likewise, अभी अब तक तो parents ने ये goals को लिख कर भी लिया होगा. So I will just go ahead. I'll go to second review. Okay. Second review, we do it after 2 months. Now Advait is 3 years 2 months. Okay. Almost after 2.5 months के बाद ये करते हैं. Goal 1 is achieved. Initiated responding to name. Initiated coming from another room. We'll say few goals are partially achieved. Okay. Like initiating engaging self in meaningful play. Okay. Because this child we saw, he was more involved in the sensory motor stage of development, where like any 8 to 10 months old child, you give him a what? He will try to put it in his mouth, bang it, throw it, try to take it. You give him a watch, you give him a car. A car दे दो तो वो bang करेगा, उसको फेंकेगा and something like that. So he this is not a meaningful use of a toy, okay, at the age of 8 to 10 months. But we thought this is achievable, but some things he started partially achieved. He initiated it in a very glimpse of moments, okay, and certain goal was partially achieved. I'm not saying what is achieved. Partially achieved the initiated eating few things on his own, just to understand whether he's aware of his own hand, because hand's evolution is happened because of the eating, okay, because of the not functioning, not writing, nothing, eating. Maybe after 1 lakh years, the squirrel will start walking on 2 legs. Okay, maybe rats will walk on 2 legs because they use their front 2 legs to eat, to take the things in their mouth. Okay. So that is evolutionary part. Is the hand is majorly used for to work on your first physiological needs. Okay, so based on that, mother stopped feeding him. It was very important that what mother should stop, because the child is not able to do. Parents become more supportive, more assistive, and more you give assistance or support to anybody else, a person will become lazy, the child will become lazy, he'll become less explorative, and he will stop learning. So if the child is having autism, give love, okay, but give more challenges that we are not available for you. You have to learn from the environment. That is a developmental approach. Okay, and based on that, we give certain goals that he will identify the objects on his own without seeing it, or certain goals we give, like he'll be able to transfer in stair descending and ascending, because we saw certain aspects of evaluation were based on his physical motor development also. And major important goal was Adat will develop a variety of solitary symbolic play. And here the child's cognitive ability was very good. So we could be very fast. And because of that fast, even the sensory motor stage within 4 or 5 months, okay, we saw the child has started playing with the car, and child started associating his experiences, his orientation. उसने car road पे देखा, he saw the train is moving on the bridge, so he started playing like parents. He started imitating parents. Okay. Then, likewise, there are many goals. We many reviews we keep. Let's say fourth review, certain things are achieved. Self objective was here. Little bit behaviors were concerned were there. So we thought let's work on a behavior. So objective of the things was self regulation and co-regulation has improved with the reduced adamant behaviors. So this is the fourth review. I'm just fast forwarding it. Certain goals were achieved, certain goals were partially achieved, because development is a reverse pyramid. Starting में you start getting these things, but जैसे से आप आगे जाएंगे, once you move ahead, more and more dimensions of development comes ahead. Okay. And so we increase the dimensions with respect to sociability, with respect to cognitive abilities, with respect to his communication, with respect to his self-awareness, social awareness, his higher functions development. We kept certain goals, and then we called him. We got certain improved this thing, and we give next goals. ये goals हम लोग देते हैं. When now Advait is 4 year 3 months, okay, he's going to nursery, and the goal is Advait will use parents' thoughts, statement, and dialogues in his daily routine communication. Okay, relevant to the situation. Like when Mama says कि uh, गिर गया, something like that. Mama is not teaching, oh, गिर गया. Mama just expressed her loss, expressed her reaction. And oh, गिर गया, something like that. And that reaction that otherwise started expressing. Okay, otherwise will start expressing. Because communication is not about talking words, sentences. Okay, communication is all about expressing your thoughts, your ideas, your beliefs, your reactions, your responses in maybe verbally and non-verbally. And autism is a communication disorder. It is not a speech disorder. So here we have not written anything that he will speak so many sentences now. Okay. We say he will start expressing like mother. That is how the typical developing child develops mother tongue. Okay. So we kept Advait on the track of the development, even though the track is slow, we kept on a track, so that he will not go away from the normal phylogenetic and ontogenetic developmental pattern. जैसे ह्यूमन का इवोल्यूशन हुआ है, वैसे ही उसी ट्रैक पर हमने रखने की कोशिश की है यहाँ पर. And he will say one thought associating one this thing. So there are a number of things we goals here we have given. I'm just trying to express this is a developmental approach. And since we thought ki now, okay, we have seen in the reverse pyramid, we have seen certain things are haywire, where the child is. Once upon a time, we were knowing that he's 1 year, 8 months old. Now we don't know how much is grown, how much the development is happened. So the clinical protocol says we say reassessment of psychological testing. So we do the reassessments over here. Now reassessment says now otherwise is 4 year, 4 months. Um, okay, at the age of 2 year, 10 months, otherwise social age is 1 year, 8 months. Social quotient was 58. But at the age of 4 year, 4 months, we have not just the parents and therapists together, they did not just stopped autism growing in their child, because autism is a developing disorder. It develops, it starts affecting the further pyramid. We did not just stop, but we reduced and we enhanced the development. So we saw the 4 year, 4 months, the social age of Advait was developing 3 year, 2 months. Okay, and this is an amazing stage. Like 58 was an average quotient, was developing till 2 years and 10 months, but now 4 year, 4 months, the average quotient is 73. Okay, right? So maybe almost after 1 year, he has covered a lot of gap. Here, Advait is cognitively sound child, okay, where we could get faster results. Okay, but I will show you, if time permits, I will show you other kids also. Attention deficit hyperactivity disorder was not a problem, even though first he was showing within 5 to 7 days, uh, the this things vanished because his sensory motor stage started evolving. But we saw something great over here, that is therapist feedback about Gilliam autism rating scale. Parents feedback is previously, this is a pre-intervention. I just elaborated. This is a pre-intervention. Okay. Very likely, parents said communication is possibly, social interaction is very likely. Autism index is 80. Now parents feedback, okay, is stereotypical behavior is unlikely. Now they don't see any stereotypical behavior. They are reduced also, and his sensory motor stage has gone into a solitary and symbolic play stage. So the hand flapping has moved into a play. Okay. Uh, uh, Communication is possibly, because now the child is grown to 4 years. So it's still possibly, because under 2 years and 9 months, he was showing some kind of a development of communication. But at 4.5 years, as per the 4.5 years, the need of communication are different. So over here, still we are seeing the lacks that is possibly, and social interaction is very much unlikely. The child goes to the society, goes to the neighborhood, started going to school, started playing verbally, non-verbally with the kids, not games with rules over here, but definitely he started being a part. He showed the inner drive to develop with the kids, okay, to be with the kids. Now that is parents. So this thing, therapist feedback, pre-intervention was communication and social interaction was very likely. Autism index was 98. But here, therapist feedback, communication is very likely. In fact, because therapist is a bit critical. At the age of 4 years, we want him to see in the school. And in the school, he should be communicating, he should be transferring thoughts, ideas, beliefs, and he will understand others' thoughts, beliefs, and ideas. Not vocabulary, but their higher functions. Okay? And other kids' ideations, other kids' uh, 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 co-regulation. He will co-regulate with other kids. Still, we are not seeing that much, but stereotypical behaviors maybe possibly, and social interaction is unlikely. So, once upon a time, therapist said very likely. Now, autism index is gone to 70. Still, some kind of autism is there, but parents claim, yeah, it is not there. It is very much unlikely. Parents are really very happy. Okay, we counsel the parents. Are you happy? Then we will have to discharge you. But if you want to work on communication, we'll continue working on some other approach, okay, of development that can be we can introduce you if you want to continue. Okay. So this is a developmental approach where goals are not about working on behaviors or you will start writing this or writing and sitting tolerance and all. Goals are all about how the child will become an efficient part of the society, how the child will become an efficient part of other kids. Before that, how the child is going to become an efficient part of the family first. Most of the time, the child is not an efficient part of the family, and we want to see the child is becoming efficient part of the society. That becomes maintenance model, and lifelong that goes on. So somewhere it's very important the child should develop with the parents connection in a joyful and a very explorative manner. Okay. uh Almost the time is over. Do you want to see one more case, or we can stop, or we will take it to the next session? What do you want to say, Prashant?
Maybe next, sir, because we are already short of time. So, if
Yes, yes, yes.
overall process is explained, like how
Yeah.
things are working, then it will be
Mm.
helpful than going into much details right now.
Yes. So I believe we can take more of such case studies. This was a this I will not say very simple child, but child brought very early. Child is you know uh, we could connect with the parents very early. Connecting with the parent is not about making them aware of autism. Connect with the parent is connecting to the biology of their instincts, biological instincts. I have a child, that is more than enough. I want to enjoy my child. I want to see my child happy. I want to see my child joyful. I want to see my child exploring the world. That is only what is required in the developmental approach. Okay. So autism. So I'll just stop sharing. Sorry. Um, yeah. Yeah. So um, in 2008, 9, 10, when the social media started evolving, or could say Facebook and Facebook, and things started, people started expressing more, and people started putting autism in their different words. Okay. So 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 in that, till then, 2008, 9, 10, 11, 12, I will say, parents were not knowing, and then the accepting, I mean, awareness was not there in the society. And awareness लाने के लिए, maybe I was also culprit, maybe I call myself because I'm part of all the professionals, कि parents में acceptance आना चाहिए. Parents should accept my child as autism. parents should accept my child as autism. Okay, that was a wrongly placed by 15 years back. And today, you know, when when you say that my child has autism, that means indirectly we say I'm autism child's parent. I'm autism parent. So this is very important. This is very important in a developmental approach where it is failing me. When I'm autism parent, I start discriminating from the regular parent. No, and then it is very difficult to bring the developmental approach. Okay, it is very difficult to bring the 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 acceptance, the real acceptance. What I believe as per the developmental approach is, I have a 6-year-old child, but he behaves like a typically 2.5-year-old child. Okay, doctor, can you please help me? How I can connect with my 2.5-year-old child? I want to enjoy my child. I want to enjoy his exploration. I want to enjoy, I want to bring the toys. I want to play with those toys with him. Maybe he was not doing, but now he's showing at least 2.5 years. So can you please explain me what is this developmental stage? I want to become a father. I want to become a mother. Father and mother has no age. They don't have age. आज भी मेरी मम्मी, जब मैं उसको मिलता हूँ, वो बोलता है कितना पतला हो गया. And now also, अगर मेरा I'm working on my diet, still she will put one more chapati, in my tiffin when she comes. Okay. It's love. Parenting का कोई भी age नहीं होता है, लेकिन comparison brings a real problem inside us and in the society. And because of that, we are living away from the developmental approach, which we used to do when out of 10 professionals, when out of 10 centers, 8 professionals were there. But nowadays, out of 1,000 centers, okay, only 50 professionals are remained. Okay, and because of and remaining 850 professionals, 850 so-called centers are so much confident in autism awareness, acceptance of autism, because they know once I uh, exclude or once I detach this parent from the biology, then then I can work on the maintenance model, which is very easy for us to do. वहां पर कोई assessment और वो चीजें करने की जरूरत नहीं है. We don't have to do any assessment for the maintenance model. आजकल मैं देखने के बाद भी बोल सकता हूँ अरे इसको ये 4 चीजें एक्सरसाइजेस दे दो. बट समवेयर इट इज वेरी इंपॉर्टेंट दैट वो एक्सरसाइज दे दो, लेकिन वो देने से क्या वो बच्चा उसका डेवलपमेंट पाने वाला है या जस्ट कुछ चीजों में इंप्रूव होने वाला है. सो ऑटिज्म इज अ डेवलपमेंटल डिसऑर्डर. वी डोंट वांट टू इंप्रूव, okay, behaviors. We want to develop the child from his base age to the normal age, and understanding the stage, understanding the dysfunction in that particular stage, and then work on it. At the end, I would like to give you example. If I have a bottle and it has this much of water, let us say, okay, and it has a lot of impurities, okay, what is the training model? Okay, I will try to add more and more fresh water. Okay, what will happen? What will happen to that water? Right? I will do a lot of training. I will teach him. I will guide him. I will teach him everything. I will train him. अगर वो लर्निंग के कैपेबल नहीं है तो पानी का मात्रा बढ़ेगा लेकिन सारा पानी दूषित हो जाएगा. It will get contaminated. That is a training model. मेंटेनेंस मॉडल इज नथिंग डूइंग. जैसा पानी है वैसे ही रखो. अब वो पानी गलत है, वो बॉटल यूज मत करना, उसमें पानी नहीं है. मेंटेनेंस मॉडल. बट व्हाट इज द डेवलपमेंटल मॉडल? Let me see what are the impurities in this water. Let me see what are the what how I can clear this water. Rather than adding something new, rather than taking him ahead with other kids, let me see. Let me stay here. Okay, let me purify this water first. Once I purify this water, then you put all the good water, it will start growing very fast. I mean, that is how I can say the developmental approach is happens, that stay, understand, observe, where the child is joyful, where the child is exploring. Not every behavior is wrong. Every behavior has some kind of a reason behind it. Don't try to reduce the behavior. Understand the behavior. Understand the need behind that behavior. It can be sensory, it can be physiological, it can be survival, it can be, autonomy phase, it can be exploratory phase. Child is here and there. He's hyperactive. No, child is not hyperactive. Child is just trying to opening the door. He wants to see what is there. He wants to see what is there in the drawer. He wants to see what is under the couch. He wants to see what is in your bag. It is an exploration. It is not a hyperactivity. So once we understand it, then treatment is really very simple. So it's like identify where is the problem. Every autism child can reach to his normal IQ stage, his level of IQ. Maybe the child's IQ is less, तो maybe वो severity ज्यादा रहेगा, तो शायद हम उसके ADL के independence तक लेकर जाएंगे, but with lot of sociability. अगर बच्चा कॉग्निशन अच्छा रहेगा तो हम उसको एजुकेशन की तरफ लेकर जाएंगे विद अ सोशलिटी, विद अ सोशल कम्युनिकेशन. And that is what a treatment of autism work on, his sociability and social communication and be a part of society, and helping them, giving them adequate challenges, giving them adequate opportunities, creating the opportunities by putting ourselves also into those challenges. So because child is going to learn from us. Once the sensory motor stage, once the pre-operational stage gets cleared, with the proper therapeutic observations and all, every child can go to the next level. I will explain you in the next sessions. Maybe I could have shown you one or two more case studies, but because of the technical glitch, I'm sorry for that. Uh, Sometimes, you try your best, but things doesn't happen. So that's it. That's it for today. We will take it to the part three, autism treatment, because uh, I believe before going into the solutions for any problem, before going into the solution, please ask right questions to that problem. Do not fall into the solutions, because maybe then solution is not right for that particular problem, or maybe your problem is not only the right narrative by you or by someone. Okay, that's it for the day. We can take few questions, relevant questions about approaches or about a rational view. Let us look at the autism treatment. What is happening in the world? What is happening around? And then we can stop today. Thank you, everyone. Thank you, Ashal.
There are many questions in the chat box. I mean, if you can just see those, because there are so many of them, and I don't think anything particular. I mean, many of you asking for the documents. Sorry, I mean, as per I understand, those are very much
Yeah, these
personal
documents
for
are,
that. Yes.
yeah, we have taken the permission from the parents that, without showing this thing, we can, as a medical model for creating awareness and all, we do use a few documents by letting parents know about it.
Yes, it's a wonderful session, sir. Well, if you can see, otherwise we can wrap up for today.
Yeah.
Would you like to know about? I mean, many questions are coming. Like I've read that somebody's asking for a difference between ADHD and autism and hand flapping and everything. So I would like to tell everyone that these videos are there on YouTube, because they have 1 or 2 hours of explanation. It cannot be told in 5 to 10 minutes. So yes. And also, if you want to get connected with CRC, I've already posted the number in the chat box. If you can see that. And Surendraji, myself, I am there in the community. You can take my number from there. You can get connected with me as well. I'll get you to connect with CRC. Anything particular you want to ask? See, I'll repeat the CRC contact number here. Yes, yeah, I'm repeating. Please write down 92215 33719. 92215 33719. You can get connected on this number. You will get all the information, whatever you need. Yes, what help you need, you will get that. Or you can contact me anytime. Okay, thank you so much. I mean, I just wanted to uh, say that कि जैसे मैंने जो सीखा था, जैसे मैंने सीखा, just in 2-3 lines, like जो रेगुलर रिव्यूज होते हैं, जो रेगुलर गोल सेटिंग होता है, आई मीन गोल सेटिंग, रिव्यू सिस्टम एंड द फीडबैक फ्रॉम द सेंटर्स, these three things really helps us parent to understand where our child is going. So this is in a very simple and the mother's language, that if my child is going to therapy center and what they are working on each session, वो मुझे नहीं पता because I'm not the therapist. So came to know, okay, in this session this happened. So this feedback system, every month review system is there, and in every depend on the child. That sir showed that okay, in some interval they are taking getting done some tests. So depend on those tests also, I'm understanding the development of the child in पर्टिकुलर पॉइंटर्स, लाइक ओके यहाँ पे नहीं हुआ है, यहाँ पे हुआ है. सो ये जो चीज समझ में आती है, दैट इज मोर इम्पोर्टेंट फॉर अस, कि ओके गोल्स आर सेट और ये चीजें. सो दैट्स व्हाट आई वांटेड यू टू अंडरस्टैंड कि हाउ डेवलपमेंट इज आई मीन measured in the goal. That's I could gather from this whole session and whole experience of, let's say, mine with my kids. So yes, uh, Anupama, I've saved your chat, and we will certainly will try to keep some question and answer session for you on everyone. Thank you so much. Thank you so much, parents, to join, and thank you so much, sir, for sharing in detail insight with us. Thank you so much. Good night.
Thank you, everyone. Thank you.
Thank you.
See you next Friday.
Yes. Next Friday, part 3.
Yes, sure.